So this is the knee replacement surgery, guys, I'm talking about. So this is how our knee works. And this side. And doctor, just a knee replacement surgery means what happens here, if you can just...
Oh, you want me to talk? Okay.
Yes, please.
That's fine. Okay, that's easy then.
So this is, by the way, Dr. Raghuram, one of the top orthopedics in the country. Sorry, doctor.
Oh. You got it right?
Yes.
Okay, so this is the front view of a knee replacement. So this is your thigh bone and this is your shin bone, and this is the metal cap or the cover which we use for the thigh bone, and then a similar one for the shin bone.
Yep.
And the articulation or the part that moves is metal, plastic and metal. Metal is usually made up of titanium alloy or sometimes stainless steel.
Yep.
This is ultra high molecular weight polyethylene. This is again a titanium. This is kept in its position
Yep.
in the bone by using either cement or sometimes a press fit.
I see.
So what we normally do is, I'm just going to take this out so that it is much easier for you to appreciate.
Yeah.
So
this is the full complete knee replacement surgery that happens. Yeah.
So what we do is we cut the bone like on a chamfer,
Yeah.
which will fit the chamfer here,
Yeah.
and we then fix it like this.
Okay. Stick it. Yeah.
Either a cement or a press fit.
Got it.
There are two types of it. Usually we prefer cement in older people. In younger people we prefer a
Press it. Okay.
Same thing happens for the shin bone. As you can see here, we prepare the shin bone,
Yep.
and then you insert this, and this is held along again, either
The
press
cement.
or
Okay.
the cement.
Okay.
Then you reduce it. The key thing for knee replacement is both the ligaments must be intact, and these must not be damaged during surgery.
So these are the ligaments, is it?
The collateral ligaments,
Ligaments.
yeah. The inner one and the outer one. And all you do is the knee replacement. So the reason why there is no pain is because the movement happens between two artificial substances,
I see.
metal and plastic. So there is no contact of bone to bone,
Got it.
and that is the reason you have no pain.
So no nerves gets pinched and things like that. Got it.
So
Got it.
the movement is only between metal and plastic.
Got it. So, and doctor, this is partial. This is full replacement. What is the meaning of partial replacement?
Partial knee replacement is where we only replace this one compartment. So all of this will be missing. I don't have a picture of it.
Okay.
So all of this will miss. So you just do the inner aspect. Usually for young people,
Yeah.
it is the inner compartment or the outer compartment that gets worn off. So you can just replace that instead of replacing the whole lot.
Got it. So just one of this will be
Yeah,
replaced.
so you will only see it this way.
And in the partial replacement, even this and this gets replaced?
Both
Like the
get
entire
replaced.
combination?
This, so half of this and half of this.
Got
You
it.
won't see this half of this.
Got it. Okay. Got it. And when in the runners, they say the runners knee, the ligament tear and all, is it this ligament?
I'll show you the ligaments in 1 second. Hello?
It's a brilliant,
Yes.
brilliant model of,
You
you can see the complicated knee structure. These are all the key things that gets worn out. And this is what arthritis is. This entire thing gets worn out, and then we have a brand new replacement happens. This is the kneecap.
Okay, thank you.
So the runner's knee line, the doctor, this
So
gets...
I'll tell you what happens in the knee. So this is a knee. This is how your native knee is.
Yeah.
Okay. And then your native knee. This is your femur and your tibia, and this is your meniscus, or the half moon cartilage as they say.
Yeah.
When the runners usually have a meniscal tear. Meniscus is not a ligament; it's a part of cartilage.
I see.
Okay, so this is the meniscus, the inner meniscus and the outer meniscus.
Okay.
This can tear. And what happens is, this is a shock absorber. So when something comes and hits here, this acts as a shock absorber. Can you see that?
Yes.
So what happens is, like a basketball player who comes and lands and he twists.
Got it.
So that can lead to a tear. You can see that?
Yes. That wear out. Okay.
So that tear is the meniscal tear. Now this is not a ligament, this is a cartilage tear.
Got it.
Whereas here, This is the ligament, the collateral ligament.
Yes.
This is the outer ligament and the inner ligament.
Right.
The medial and the lateral ligament. Both of these can get injured.
Got
The
it.
commonest thing that gets injured is the ACL. You heard of the
ACL tear. Yes, no, of course.
So if you have a look here,
The inside one.
yeah, so that is the ACL here. Can you see
Got
that
it.
ligament going in there?
Yes.
That is your ACL.
Got
Here
it.
you can see here, I've taken the ACL off. So see here, that is
Yes,
the ACL, and
yes.
that gets cut.
Yes.
And then your knee will do this.
And it, okay, and scratches even more the pains.
So
Got
the,
it.
the ACL prevents the knee from doing this. Right? So when the ACL is gone, when you're coming down the steps, the knee doesn't buckles.
Fantastic.
That is your ACL, and this one is your ACL,
Got it. Got it. Got it.
and this is your PCL, posterior.
Posterior. Got it. So one of these gets torn by running also causes the
That
misalignment.
needs to be repaired or replaced.
Okay. And the PT syndromes are wrong. I mean, like, you know, the, what is it? It's another very common thing in runners. You know,
Jumper's knee.
Sorry, I just PT, like, you know, feral syndrome. Pen, you takkana marandi pettene, unfortunately. Maybe there's a tear on the right side. I don't know. Most runners have that, and they call it runner's knee. So runner's knee is நீங்க சொன்னதா இல்ல வந்து
No, runner's knee and jumper's knee. The runner's knee it happens within the patellofemoral joint.
Patellofemoral syndrome. That's what I was asking. Correct. Patellofemoral
That
syndrome.
is this. So the
Kneecap.
knee has got 3 points,
Yeah.
3 joints. The outer aspect, inner aspect, that is what Amma got replaced. And
Yeah.
there's another joint called the patellofemoral joint, the patella and the femur.
Got it.
This is the patellofemoral joint.
Yeah.
Okay. So what happens is when you do this, there is a friction between here and here, and also between there and there.
And there, yes.
And that is your patellofemoral joint.
Got it. And if that gets worn out, that also causes additional
That is
pain.
correct. It causes additional pain. This gets worn out here like so, and that causes pain. So the cartilage here and here gets worn out.
Right.
That is patellofemoral.
Got it, sir.
That is your runner's knee.
Got it. That's all. Thank you, doctor. So this is Dr. Raghuram, and who did a fantastic job for my mom, and she's replaced both her knees. Thank you, doctor.
That is an enabling.
Thanks a lot.